My name is Lexi Crook. I'll be demonstrating the side laying position for patients. So if patients can't get out of bed or they haven't been out of bed in a while, we need to make sure that we're turning them Q2 hours to prevent pressure wounds. So if we do not turn these patients, they can develop really nasty wounds that take years to heal if they ever heal. These wounds can lead to infection and sepsis as well. Important information that the nurse needs to keep in mind: you want to lay them flat before turning them, and then you're turning them to get them off their posterior side of their body, so you don't want them laying directly on their shoulder either. That's uncomfortable. So you kind of want to do the meet in the middle to where you're just getting the pressure off of their bottom. Assessments that you could do when you're turning them: you want to look at their skin throughout their whole entire back, make sure there's no redness, no open wounds, make sure there's no cords that could lead to more pressure injuries, and then you're also making sure that they're clean too when you're turning them. Key points to make sure the patient is safe: make sure that the side rails are up when you're turning them so they don't fall out of bed, and also if they're on any tube feeds, you can't lay them in a supine position. To roll them, you have to keep them in Fowler's position when you're rolling them. You need 2 people to perform this so that you don't break your back or have any shoulder injuries. And then education for the patient, making sure that they know that they need to stay in that position for 2 hours, or unless they're getting out of bed, and then also putting pillows under their arms when they're rolled to prevent pressure injuries on their elbows. So we're gonna demonstrate for you. I have 3 pillows right here and a helper. So I'll just start by asking her to roll this way, and I'll help her roll. And I'm gonna take 1 pillow, put it behind her back, and then another pillow and just put it below that. And then she can roll back. And then I'll place another pillow under this left arm for comfort. And then that's it. And she can lay in Fowler's position like this too, with whatever's most comfortable.
Hi, I'm Danny Sanders. I will be demonstrating the supine position. So right now my patient is in the Fowler's position, and I'm just going to take them down to a 180-degree angle. This position is best used for certain procedures or assessments, such as GI assessments. It's also used for comfort and sleeping, but it can cause pressure sores if a patient is left in this position for too long. Areas such as the lumbar or cubital regions, and then bony prominences such as the elbow region, are at an increased risk of pressure sores. In this case, you can put pillows underneath their arms to try to prevent this, as well as a rolled up towel under the knee region or the lumbar region for extra lumbar support. And you do want to make sure that their head and neck is supported in a neutral position with a pillow. And then patients you do not want to put in the supine position include patients with respiratory diseases such as pneumonia. This will make the respiratory distress worse and just essentially make it harder for them to breathe. Patients who have just had abdominal, chest, or breast surgery also do not want to be placed in this position due to the increased pressure of gravity. And then it also reduces the ability for surgical incisions to drain and everything, since they are completely flat.
Okay, I'm Vanessa Averill, and today we are going to reposition our patient into the high Fowler's position, which is where the head of the bed is elevated to a 60 to 90 degree angle. In this position, you want to watch for pressure ulcers on the sacrum and calcaneal region. The patient's legs can be straight or they can be bent at the knees, and you can put a pillow under the knees for added comfort, and also under the cervical region as well. This position is good for patients who are having breathing difficulties, who are post-op and they need extra care. It improves cardiac output. It also improves respiratory functions and promotes ventilation and oxygenation. People who are at risk for, it reduces the risk of aspiration in patients who have trouble swallowing. It is a good position for assessing it's a good position for respiratory assessments, cardiovascular assessments, abdominal assessments, oral cavity assessments, and for checking the patient's vitals. Patients in this position are at higher risk of orthostatic hypotension, so blood pressure will want to be monitored closely. And things to check for is poor circulation, the breakdown of skin, pressure ulcers, and respiratory distress. And just make sure your patient is comfortable, they're not having any pain, and their body is aligned.
Hi, my name is Austin McCool, and today I'm going to be talking to you about patient repositioning, specifically the Fowler's position. So currently our client, Juno, is in the supine position. And essentially the Fowler's position is going to be where the patient is still supine, but the head of the bed is elevated. 45 to 60 degrees is the range we're looking for. Specifically, there are other positions that are outside of those range of motions, like a low or high Fowler's. So for the patient to be able to be transitioned into this Fowler's position, you want to make sure they have proper body alignment. Their head is supported by a pillow like Juno has here. You're going to want their arms to cross over their body. That's actually something Juno can't do. She doesn't have flexion in her arms. That's okay for today. And we want to ensure that we monitor their change, if there is any change, when we reposition them back up. So if there's any pain associated with the movement, I'm going to be monitoring any fidgeting in the body or the face for facial expressions. So first thing, before I kind of go into some key points about the Fowler's position, I'm going to reposition Juno into 45 degrees. She is plugged in, so you might hear the battery or the charger fall down. Watching the degrees here on the bed is actually super helpful for me. I'm going to wait till it hits 45 degrees, but in the meantime, I'm going to watch Juno make sure she's okay. Her legs are actually straight, but one thing you could do for client comfort if needed, if they're not flexible enough or it's too painful for whatever reason, you could actually put something underneath their knees to flex, or you could have them hold a flex position. So the patient is currently supine. The lower body is going to be nice and flat and supine, about 180 degrees where the body was originally. And the upper body is going to be about 45 to 60 degrees. I just stopped there at 46 degrees today. So some risks associated with the Fowler's position are going to be, of course, pressure injuries, which is why it's important for us to reposition our clients quite often depending on the individual. So some of the areas you want to watch out for is the sacral region, coccyx, the ischial tuberosities, popliteal and calcaneal region as well. All the things on the posterior side of Juno here. You want to ensure that there's proper skin integrity throughout the posterior side of the integument on Juno as well, the upper back, the lower bandages as well. There are other things associated with the Fowler's position you want to look out for. As you can imagine, gravity is assisting us with drainage going down. So there's a risk for DVT, deep vein thrombosis, due to reduced blood flow, and you want to keep an eye on that for the lower limbs. There's also potential nerve damage risk for those who have current spinal or neck injuries, which is also something you want to consider before you put someone into a Fowler's position. So currently, if there's some spinal injuries, flexion at the waist might be an issue. Flexion at the neck might be an issue. So consider before you put a patient into this position. Also, airway loss is potential, and then facial edema is another symptom you want to look out for if there's complications in this position. So why do we use this position? Mainly the Fowler's position is used for the comfort of the patient, primarily when they're in a rested state, not in an active and alert state. When they're in a rested state, this can be a nice area that's post-op from abdomen surgery to support drainage. Also, it helps promote lung expansion and oxygenation if someone's having trouble breathing. So think about when someone is experiencing dyspnea in their lower breath on a supine position, you You want to first elevate the bed after you've done all of your assessments to see if that's going to support with that respiration and oxygenation. So this skill is super important because it can actually support with restorative care and range of motion exercises for patients who are maybe at the time bedridden. So think of the limbs that you can move. You can flex and extend your arms in this position. You could do neck rotations, flexion and extension. This is patient dependent. Same thing for the lower appendages as well. So take your legs, do flexion and extension, wrist circulation as well. So some assessments you can do during repositioning and post repositioning is, like I said, evaluating for pain. Is there a change in facial expressions? Is there body movement kind of indicative of a pain going on? Are the respirations changing? Assess the skin integrity. Make sure they have proper body alignment in this position, especially during repositioning, because that could lead to an issue or injury as well. When they're in this position, it's actually a pretty nice position to be able to take some vitals. Easier to get a certain few vitals when they're laying up versus being flat or having to stand them up before maybe you have them swing their legs around the bed too. So key points to keep into consideration are going to be especially the head support here. Juno has a pillow, and keeping it in a neutral position for the spine. It would be very pertinent to inform the healthcare team if there's any pain experienced by the patient in this position. That's all I have for you today. Thank you.